Hey, welcome back. This is gonna be my second video for the extra credit for videos that I have to do. So for this one, we are gonna be covering the conduction system of the heart and how it relates to the electrocardiogram. Okay? So how does this system work? So the cardiac conduction system is pretty much a network of nodes that it is pretty much is involved with your heartbeat, right? So these nodes and bundles they activate in like a specific order, just like a machine, right? So they activate in a specific order to help regulate your heartbeat and your heart rhythm for your body, right? So step one in the process is the sinuatrial, I'm gonna butcher the name, sinuatrial SA node, right? So this node is located in the right atrium, and it's pretty much a patch of modified cardiomyocytes, right? The purpose of the nodes, it pretty much helps to initiate the heartbeat and to determine the heart rate. So it pretty much is just an instigator. It's the one that starts the process of the actual heartbeat and the rhythm. So that way the other nodes know, okay, yo, this is what's happening. So step two is I called it spreading the news, right? So once the SA node activates, its signals are spread throughout the atria so that the other nodes are working can prepare like I mentioned before. So SA node activates, starts the heartbeat and the heart rhythm, then that signal is spread through the atria to the other nodes and bundles so that they are aware so they can start preparing as well. So step number three here is the atrioventricular or AV node. So this node serves as the gatekeeper between the atria and the ventricles. So what it does is it prevents the electrical currents from going to the ventricles by any other route. So it hopes it will go from point A to point B without spreading out, right? So this serves kind of like a Gandalf, like you shut out pass, like gatekeeper for that stuff, all right? So that's what the atrioventricular AV node is for, okay? So the atrioventricular bundle is the pathway where the signals leave the AV node. So in terms of where it's located, it forks to the right and left bundle branches that sends the signals towards the apex. So once the AV node sends the signal, sends it to the AV bundle. Once the signal leaves the AV node, it gets sent to the AV bundle, and then this bundle sends the signal down towards the apex of the heart. Okay. So how does the conduction system relate to the electrocardiogram? The the conduction system is the heartbeat and heart rhythm. The electrocardiogram is a machine that relies on this system, the conduction system, to tell if the to tell the heart rate of a patient, right? So it measures the heart rate and the heartbeat of patients to make sure if the heart rate is stable or if it's unstable. So you can't have an electrocardiogram without the conduction system because the electrocardiogram is completely reliant on the conduction system itself. That's why it relates to the conduction system. So the final step of the conduction system is actually the subendocardial conducting network. So this network comes from the lower end of the bundle branches. I should have actually put it like this, so it could have ended like that. But this network comes from the lower end of the bundle branches. So what it does is this goes into the apex heart and it spreads around, and it sends everything to the atrioventricular septum at the base of the heart. And so what this does is this spreads the impulse, like when the heart makes the beat, the movement, this spreads that impulse to the contractile cells that are located inside of the ventricle. Okay? So I already covered how it relates to the electrocardiogram, but that's pretty much the conduction system of the heart from what I could gather. Thank you and take care.